So they were not leaking outside the capsule, but I want everybody listening to this to listen extremely careful to what I say next. I have a very nice woman who came to the office this few weeks ago, and she's in her 70s, and she's got symptoms of like joint pain and some fatigue, and her integrative doctor said, you've had those breast implants since 1982.
Wow.
And she came to me and she told me this story, and I felt, I did her exam. And first of all, when I do an explant, I consider everything to be ruptured, 100%. I never ever care what your MRI says. I don't care what your doctor says. I don't care what your ultrasound or mammogram.
Yeah.
So I told her, I was like, look, I've only taken out, I guess, one set of Dow Corning implants from the 70s that were intact ever in my entire career. That's almost 30 years.
Yeah.
I took her to the operating room actually yesterday and did her case. And she was, at that era, she had silicone gel implants from Dow Corning above the muscle because that was the standard at the time frame. And of course, they were ruptured. So they were not leaking outside the capsule. But I want everybody listening to this to listen extremely careful to what I say next. The capsule is not impervious. It is not a nuclear bomb shelter. Your tissues will interact with the device within your scar capsule, because think of something that's woven versus something that's solid. It's not solid. So I open everything. I make a video for every patient after I get done so they can see exactly what everything looks like in real time. So I open this thing up, and of course it's ruptured. Both layers are ruptured because a shell has two layers. So both layers are ruptured and completely devoid on one side. Just a bag of jelly, of which I took out perfectly intact, by the way. And then on the other side, it has a outer shell intact, but the inner is obviously ruptured. You can feel it. You can move it. You can almost see it on the video. It's a little bit hard. But I don't want anybody to think they're protected from the device because their body makes a scar capsule. That is false.
Yeah.
Amen. Yeah.
And I think that's why, in the published studies, we're seeing elevated silicone levels on serum testing. It's clearly leaching through.